extremity, and then I'll stop for questions if there are any, but I'll do lower extremity, which will probably take us to about 2 o'clock, or a little past that, and I'm not gonna rush it. But first, for naming, just, this is probably second nature by now, but I'll do it. One of these bones is an os coxa or a hip bone. I forgot to bring one out, but if you just have one of these, and we kind of study features of an os coxa or a hip, that's the only two names they're gonna use on the final. Either hip bone, more likely os coxa. Is everyone clear that we have two? Each of us has two hip bones, same as two os coxa. That's an irregular bone. I'll do the categories later, but that's a hip bone. Now the pelvic girdle, actually, to be honest, I'm probably not going to ask pectoral girdle. Pectoral girdle is confusing. It's all the connecting bones of the two upper extremities. I forgot to mention it, but technically, there's 4 bones total in pectoral girdle, 2 clavicles, 2 scapula. So there's 4 total bones. That means all the connecting bones. Remember we established early on that axial skeleton is only bones of the head, and then or skull, vertebral column, rib cage. Axial is just skull, everything, vertebral column, everything, rib cage, everything. And if it's in the limb, that's appendicular. All the bones of the 2 upper and lower are appendicular, with the little amendment that connecting bones that anchor or connect an extremity to the axial are always classified as appendicular. So that means clavicle, scapula, os coxa are appendicular. Clavicle, scapula, and the 2 os coxa, even though it might look like they're axial, everyone agrees from an evolutionary, functional, everything point of view, they're definitely appendicular. And so there's 4 connecting bones in the upper extremity, 2 clavicles, 2 scapula. But in the lower extremity, there's only 2 connecting bones, because they're kind of, on the sense that clavicle and scapula fuse to form a giant os coxa. That's not on the test. But there's only 2 connecting bones in the lower extremity. Is that pretty clear? That the bones that connect the 2 lower extremities to the axial are just the 2 hip bones. And the name for that is pelvic girdle. That's confusing. So pelvic girdle means the 2 hip bones, the 2 connecting bones. Just like pectoral girdle means 2 clavicles and 2 scapula, 4 bones. All the connecting bones bilaterally, both sides. In the lower extremity, pelvic girdle means 2 hip bones. You're unlikely to ask that. But it's confused with pelvis. That will get asked, usually. The pelvis means basin in Greek. Pelvis means basin because it's a basin shape that totally surrounds visceral organs. Ignore L4, L5. It's in the model to illustrate some other stuff. But there's 4 bones that make up the pelvis. If they say how many bones make up the pelvis, it's 4. But the names would more likely 2 os coxa, 1 sacrum, 1 coccyx. So the 4 bones that make up the pelvis, I've seen that question. You probably had that type of question. The 2 os coxa, 1 sacrum, 1 coccyx make up this total basin called the pelvis. Okay, then I'll do the articular features of 1 os coxa. And clearly there's 2. In the appendicular skeleton, there's 2 of every bone. There are no unpaired bones. That's not a test issue. But in axial, there are some unpaired bones. Skull, sternum. There are a lot of unpaired bones in the skull. And there's all vertebral column bones are singular. This can get tricky. That's why we don't ask it. And the sternum, we only have 1 sternum. But because we have 2 upper extremities and 2 lower extremities, all bones of extremities are paired. Not a test issue. But for an os coxa, the 3 articular features that are emphasized are acetabulum. Definitely, that's the most important feature overall test-wise. Then the auricular surface, and actually, I forget. Oh, does anybody want one of these? Probably If not, it's not a teaching type of class like that. I mean, it's a teaching class, but it's more, we're going fast, so. This is an ear-like. This is the auricular surface of the os coxa. That's articular with the auricular surface of the sacrum. I jumped ahead, but that's articular. The acetabulum, the giant socket's articular for the hip joint. And then the tricky one, maybe not tricky, the body of the pubic bone with the disc of fibrocartilage connecting it to the other body. That's, even though we don't think, that's not synovial, that's symphysis. I almost said syndesmosis. Symphysis, the S word confuses me also. But because it forms the pubic symphysis, the body of the pubic bone is considered articular. I don't think that's going to be a test issue. Did everybody learn that as an articular feature? Did you learn body of pubic bone as articular? If not, don't worry about it. You might have just learned it in just there, but okay. I emphasize it's articular. I'm not sure why. Well, because it is basically. That's why. But often that's sometimes not mentioned. But everyone knows this forms the hip joint, ball and socket with the head of the femur. The acetabulum is the giant socket for the hip joint with the head of the femur. So that's easy. Acetabulum articulates with head of femur to form the hip joint, ball and socket. And then, not as obvious, but hopefully, I think everyone probably had this, that the auricular surface of the sacrum articulates with the auricular surface of os coxa with the similar name, similar shape, auricular surface of sacrum. That's the famous sacroiliac joint. Did everybody have that?
Yes.
Because those two are always on the test. Body of the pubic bone might not be in that sense on the test. The type of joint will be, but these two features are emphasized the most of the os coxa features. Acetabulum forms the hip joint with the head of the femur, and the auricular surface articulates with the auricular same of the sacrum. If my hand is the sacrum, it's auricular surface to auricular surface. It's a modified, still gliding synovial, even though it's a little less movable than a typical gliding. If they ever ask for sacroiliac, it's gliding synovial. Gliding synovial. Okay, and then the body of the pubic bone, or just sometimes you just say pubic bone. Pubic bones articulate with each other, and what type of joint is the joint? The code for this joint on a test, because they don't want to give you the name because it tells too much. They might say, is everyone clear that they say the joint? So I'm going to give you the standard type of wording on a test question. The joint between the two os coxa anteriorly is what type of joint? I'm going to give choices. The joint between the two os coxa anteriorly is what type of joint? A, hinge, B, gliding, C, ellipsoidal, D, symphysis. Yeah, because if they say pubic symphysis, that tells you too much. So they often say the joint between the two hip bones anteriorly. And just know it's a symphysis joint, because it is the pubic symphysis, non-synovial. Symphysis, definitely non-synovial. Okay, and then here's the other question. This is on every test question. Which joints are the only joints between axial skeleton and bones of lower extremity? Which joint or joints are the only joints between axial skeleton and bones of lower extremity? A, pubic symphysis, B, hip joints, C, sacroiliac joints, D, sacrococcygeal joints.
B.
Sacroiliac, right?
Yeah.
Everyone knows. Same as sternoclavicular. For upper extremity, the only joints between axial and upper extremity are the two sternoclaviculares. Less strategic because they're not weight bearing. But in the lower extremity, the only joints between axial, because the sacrum is axial, and appendicular, because the os coxa are appendicular. The only place where axial meets appendicular in the lower extremity are the two, it's on every test, are the two sacroiliac joints. So only joints between axial skeleton and bones of lower extremity, very strategic for weight bearing and transmission of weight and balance, are the two sacroiliac joints. Okay, so know that. And then other features of os coxa is not millions, there's about 16, 17. So don't worry about, they're almost all from muscle attachment. The one that's unusual, obturator foramen, even though it is muscle attachment indirectly, not on the test that way, just know non-articular. A foramen can never be articular. So just know this giant, it's the largest foramen in the body. It's larger than foramen magnum. That's obturator foramen. And then I'll give you a standard type of question. Which of the following features of the os coxa are from muscle attachment? Which of these are from muscle attachment? A, iliac crest, B, iliac fossa, C, anterior superior iliac spine, D, ischial tuberosity, E, all of them, then F, maybe A, B, C only. So which of those are from muscle attachment? I think I said iliac crest, iliac fossa, the other one I said ASIS or anterior superior iliac spine, ischial tuberosity. All of them. Almost everything except the articular features, especially acetabulum and auricular surface. Like this room over here, don't make somebody move. You can sit in front. It's of course it was reserved. That's why it's left. You have to pay a little extra, but it's worth it. Okay, so all of those are muscle attachment, and in general, any tuberosity is muscle attachment. Anywhere, never articular. Tuberosity by name is muscle attachment, and any crest, like tibial crest, is muscle attachment. Any crest is muscle attachment, and tuberosity crest. Any spine is muscle attachment, whether it's spinous process of vertebra, spine of scapula, or any of the four, os coxa, ASIS, AIIS, PSIS, etc. All spines are muscle attachment. And then we did it before, we'll get it again, all styloid processes are muscle attachment. So you can tell generically, styloid processes, spines, tuberosities, crests are all muscle attachment, never articular. Okay, that's probably enough for the os coxa. I think, yeah, I did everything. Just know this is greater sciatic notch. This would be greater sciatic notch. That's neither muscle, that transmits sciatic nerve. We're not going to ask which nerve, but that would be the greater sciatic notch. It's actually part of the ilium, and then lesser sciatic notch doesn't really do anything, but that would be the lesser sciatic notch. So greater sciatic notch, lesser sciatic notch, which is ischium actually. Okay, and then femur is actually, because of its size, it's fairly straightforward. And now for femur and tibia, this is not on a test, but each of them has 4 or 5 articular features. There's more articular features. Actually, femur has 4, tibia has 5. We're not going to ask that. Okay, so I'll do the articular features first. Everything else will fall into place. For femur, head of femur is articular with, this would be a left actually. Don't worry about left or right arm. But this articulates with acetabulum of os coxa to form hip joint. So head of femur with acetabulum to form hip joint, ball and socket. So that's a big one. The head is in the hip joint. Then because this is much easier than the humerus, when you had the trochleus and the capitulum blend together, they're not separated by like the two condyles, and they're not called condyles. But this becomes easier on the femur because you have medial condyle of femur articulates with medial condyle of tibia, and lateral, it's medial condyle, lateral condyle, the lateral condyle for femur tibia, that's the knee joint. So the medial condyle, this huge medial condyle articulates with medial condyle of tibia to form part of the knee joint hinge, and then the lateral condyle, this is very logical. medial condyle to medial condyle, lateral condyle of femur to lateral condyle of tibia forms the other part of the knee joint. It's hinge.